Welcome to Medicare Simplified, a podcast by Sanford Health Plan that will help you make the most of your Medicare Advantage benefits. I'm your host, Mick Gary. Today we're going to help you decipher prescription coverage under Medicare. It can be a daunting project because there are so many ways to get prescription coverage. There are lots of questions that come with the process itself, but also with the kinds of issues you should be talking about with your agent when you are comparing options. To help us learn more about Medicare prescription coverage and the kinds of questions we should be considering, we're joined today by Jack Arnett, an inside sales manager for Sanford Health Plan. Jack, let's start with the basics. What drugs are covered by Medicare Part D for seniors?
Thanks, Mick. Good to see you again. Always glad to participate with these podcasts. So what drugs are covered by Part D plans? Mick, each plan has a formulary. Medicare will set the parameters for Part D drug companies, and these are private insurance companies that Medicare says you must cover at least this. But drug companies are allowed to expand on that, and they create a formulary, which is a list of covered drugs, and it's a wide range of prescription medications that are generally then put into tiers or categorized into tiers.
What do different drug tiers mean?
Sure. Formularies, like I said, have different tiers, and they're generally what you will see on most prescription drug plans across the country are tiers 1 through 5. Some will actually have 6 different tiers. The lower the tier, the lower the cost of the drug. Tier 1 and 2 are normally your preferred generic drugs or just basic generic drugs. Most of those will come with either a $0 copay or a very low copay. And then you get into your preferred brand name, and then your brand name, and then your specialty drugs. The higher you go with the tiers, the more expensive those drugs are going to be. So when a Medicare beneficiary is shopping for a Part D coverage, having a list of the prescriptions that they're on to do a review with the agent or however they are, or whoever's helping them, enroll to the plan is just very, very important because that will give them an accurate account of how much they will pay for those prescriptions.
It does seem like when you're reviewing this and when you're making those decisions that having a chart available to you would make this maybe a little bit clearer for some people?
It does. And I, in my career, and I've been involved in Part D since it began, I've literally helped thousands of individuals, with their Part D coverage. The ones that come prepared, a full list of their drugs, the pharmacies that they want to use is just very important because there's just an outstanding tool that Medicare provides all beneficiaries and all individuals actually that are helping an individual enroll in Part D, and it's called the Drug Finder, and that can be found on Medicare.gov. We simply enter the zip code of that individual. It'll pull up all the network pharmacies. We can enter the drugs. We don't even need the spelling because just normally the first couple letters, and this pops up automatically. The cadence that they take that drug, the dosage, enter all those, and then hit the enter button. Medicare will list every Part D plan available to that individual based on costs. And cost will include, like we said, the tiers, the copays that they would pay. There's generally a deductible associated with most Part D plans. So yeah, the more you're prepared, the better it will go.
Great. We hear the term pharmacy network. What does that entail in this context?
For most Medicare beneficiaries, they've been with the same pharmacy, for quite some time, maybe even for their lifetime. And so when they're considering Part D coverage, just like a healthcare provider, a doctor, a specialist, a hospital, Part D plans have network pharmacies that participate with that individual plan. Now, Mick, I can tell you that some of the national pharmacies participate with just about every Part D plan. Matter of fact, and I'm just going by memory here, the last 5-6 years of Part D coverage, it's rare that you would find a pharmacy that doesn't participate in the vast majority of plans. But that being said, you are going to absolutely want to be sure that your Part D plan participates with the pharmacy that you want to go to.
How about when you're traveling?
Great segue, Mick, especially with some of the national ones. Here in South Dakota, we have a lot of Medicare beneficiaries that may head south for the winter. And so if you get your drugs at a local, what I would call kind of a mom and pop type shop versus any of the national pharmacies, CVS, Walgreens, things of that nature, Walmart, you're going to want to make sure that you can get your prescriptions filled, at those pharmacies across the United States. For some that don't participate, in any of the national, pharmacies, a lot of them when they travel will make sure that they have enough for that, however they're long, maybe get a 90-day supply instead of a 30-day supply. But for most Medicare Medicare beneficiaries, if you're getting, your prescriptions filled at what we would call more of a national brand pharmacy, you are absolutely going to be able to get that filled, whether you're here in South Dakota, North Dakota, Minnesota, or, Florida, Arizona for the wintertime.
When we're going in there, Jack, and asking questions for the first time about this process, what are some really important things that you should ask your agent as you navigate the process?
When finding a Part D plan and working with that trusted advisor or that licensed insurance agent, that is approved to market Part D plans, the first thing you want to review is have that list of prescriptions, your own prescriptions that you take, and then put that up against the plan that you're considering. Medicare allows a deductible for all Part D plans. Now, some plans choose not to put a deductible on it. Some have a partial or some have the full deductible. So that plays into it. And then there's the copays that an individual will pay. And it does vary plan by plan. The drug may be the same, but one company may charge X and the other company charge Z. So you absolutely are going to want to pay attention to those cost shares because that will impact you, financially. And then are there different plans that are available that you can choose from? For a Medicare beneficiary, there's two ways of obtaining your prescription drug coverage. One is just from a standalone prescription drug plan. These are private insurance companies that just offer prescription drug coverage, nothing else associated with. But what we have seen in the last several years is well over half of the 63 million Americans on Medicare is that they're choosing to get their prescription drug coverage through what's called a Medicare Advantage plan or Part C of Medicare. A lot of Part C plans or Medicare Advantage plans actually build in the Part D component right into the plan, so you don't have to shop for a standalone Part D plan. I think another thing that Medicare beneficiaries want to consider when they're looking at Part D plan are the costs, and we kind of mentioned that early on, but I'm going to come back to that because costs make a big part of that decision-making process. As I mentioned before, deductibles, copays, cost shares, those are all very important, and I think it's important to even review maybe a track record of a particular company. Have they had nominal increases that most of us expect? Has there been quantum leap increases or kind of a roller coaster effect that we have seen, high one year, down the next, and it's very hard to budget, that way. Another thing, are there any rules or limits that individuals need to know about relative to switching plans? Whether, in our own personal lives, we change anything from the gas we buy to the milk we buy, sometimes we just become dissatisfied with a particular brand. People just can't switch drug plans anytime they want. Medicare has certain rules, certain enrollment periods that do allow for a plan change. But then there's also a good chunk of the year that you're going to be locked in. So when you're talking with that licensed insurance agent, that trusted advisor, make sure she or he educates you, relative to that. And then maybe one of the most important things is having that your own list of prescriptions available. Are my drugs covered? I mean, that's the first thing, if the plan looks good, the costs look good, everything is great, you've heard of this company before, you've seen their advertising, everything looks good, but if they don't cover your drugs, then what good is it? So there's just a variety of things, and Mick, I think you kind of alluded to it before, there's a lot of nuances in choosing a drug plan, a prescription drug plan. And so, where individuals are certainly allowed and free to navigate that process themselves, there's also a great deal of resources available. One is going to, the Align website, which I know you'll share for the folks here in just a little bit. We do stay on top of Part D. There are some changes coming for 2025, and we'll be posting some of that information on our website. We'll be hosting a lot of informational sessions, come this fall throughout the region. And so people can stay, in tune to that. But more importantly, get with a trusted advisor. Get with somebody that you know personally, that you have worked with in the past or comes highly recommended, and let that individual kind of usher and guide you through that process. We feel best when we're well informed in making decisions. And that's what's going to give you peace of mind, is working with someone that has experience in this field, then help you navigate all the many turns that you're going to, and the many decisions you're going to have to make.
Just listening to you talk on this, respect the challenge, it's a big one, but also have some faith that there are a lot of people and you will have access to information.
Yeah, absolutely, Mike. And, prescription drug coverage is a good thing. I've helped a lot of people in the past that take little to no drugs, and why should I enroll into a plan if I'm not going to use it? Number one, none of us have a crystal ball and know what our health will be, weeks, months, years down. There's that old cliche, would you rather have it and not need it, or need it and not have it? And so for most individuals, having that peace of mind that they have solid prescription drug coverage. My earnest hope is that no one ever has to use it, because they've stayed in good health. But we know better. And we know that Medicare beneficiaries throughout their life may have some health challenges that are going to require prescription drugs, as part of their regimen. And so, there's so many options out there, but they're good options. And this is a good thing. And we're here to help. The folks at Sanford Health Plan, we are here to help navigate. Whether you're a Sanford Health Plan member or not, we just provide that solid education to help you make those informed decisions.
Great, Jack. Appreciate that. Thank you for sharing your expert insights today on questions to ask when looking for Medicare prescription coverage. If you'd like to learn more about Medicare Advantage plans options from Sanford Health, visit align.sanfordhealthplan.com or find more information in our episode show notes.